And good day, everyone. My name is Mike Hamilton. I'm Medical Director at ISMP Canada, and welcome to a special edition of the Med Safety Exchange. And thank you all for joining us. We know that you're really busy doing great work, and we really do appreciate you having in the audience for what is a very special episode today. We'll begin by a land acknowledgement for our offices in Toronto, but I encourage you to really reflect upon where you work and reside. We acknowledge that we are hosted on the lands of the Mississaugas of the Anishinaabe, the Haudenosaunee Confederacy, and the Wendat. We also recognize the enduring presence of all First Nations, Métis, and the Inuit peoples. And we are very grateful to live, work, and play on this land. And we do want to contribute to the implementation of the Truth and Reconciliation Commission's 8 health-related calls to action. So this webinar is a production of ISMP Canada and CMERPS, and with contributions from all of our great partners in medication safety, and certainly you, the audience. The Med Safety Exchange is presented on the Zoom webinar platform. Audience members are automatically muted, your video is disabled, and the presentation part of this webinar is being recorded and will be available on our website in about 2 to 3 weeks or so. There are a few ways to make comments and to submit questions. From the Zoom toolbar, which is typically at the top or bottom of your screen, you can use the chat panel to introduce yourself, tell us where you're from. You can also make comments and ask questions via the chat. All chat entries will be visible to the audience. If you select the Q&A tool, a window will open up. You'll have the option to submit anonymously if you check the box below. Responses will appear in the Q&A panel, and questions will only appear in the panel once they are answered. And please email us at medsafetyexchange@ISMP Canada if you have any questions or comments or ways to improve the show, or if you do want to contribute and participate. Anything we don't get to today, we'll try to answer offline. So we have a terrific webinar planned to help celebrate World Patient Safety Day and inspire all of us to elevate the voice of patients. And in support of these objectives, we do have a welcome from the World Patient Safety Day. World Patient Safety Day is observed annually on the 17th of September, and it aims to raise global awareness about patient safety and calls for solidarity and united action by all countries and international partners to reduce patient harm. This special episode of Med Safety Exchange recognizes World Patient Safety Day that happened a few days ago. And this year, the WHO has designated the theme of World Patient Safety Day to be Engaging Patients for Patient Safety. So we are especially pleased to be able to converse with you. And the slogan this year is Elevate the Voice of Patients. And the WHO calls on all stakeholders to take necessary action to ensure that patients are involved in policy formulation, are represented in governance, are engaged in co-designing safety strategies, and are active partners in their own care. The objectives of World Patient Safety Day in 2023 are to raise global awareness of the need for active engagement of all patients and their families and caregivers in all settings, all levels of care. To engage policymakers, healthcare leaders, healthcare workers, patients' organizations, society, and other stakeholders in efforts to engage patients and families in the policies and practices for safe healthcare. Empower patients and families to be actively involved in their own healthcare and the improvement in the safety of healthcare. And to advocate urgent action on patient and family engagement aligned with the Global Patient Safety Action Plan from 2021 to 2030, available on the WHO website, and to be hopefully taken up by all partners. And I'll present a video from the WHO that I think clearly illustrates these objectives.
We had so many questions.
They didn't listen to us, again and again.
No one told me what went wrong.
We all have the right to safe healthcare.
each one of us.
Most of the harm caused to patients can be avoided.
Safety starts with us.
We have the right to ask questions,
And to get answers.
To express our opinions and concerns.
To know if something went wrong in my care.
And families, as members of the health team,
care becomes safer.
When I listen to my patients.
When we are transparent.
When we learn from patients' experiences.
When we make decisions that include patients' voices.
When we partner with patients and families.
We save lives.
When I am heard, I can make a difference in my own care.
And the care of others.
Together,
we can achieve safer healthcare.
For everyone.
We're very fortunate, I think, in Canada to have very close ties with the WHO as we all work together towards improved patient care, both here in our own country, but also around the globe. And now I'd ask for a few words of welcome from ISMP Canada's CEO, Carolyn Hoffman.
Thank you, Mike. On behalf of the board and staff of ISMP Canada, it is my great pleasure to welcome you, to thank you for joining with us to commemorate the WHO World Patient Safety Day. Why is it important? Well, it's a global call to action. Why do we need a global call to action? Because patient harm due to unsafe care is one of the leading causes of death and disability worldwide. Millions of patients are harmed every year. How does that translate to Canada? Tens of thousands of Canadians die from preventable harm related to their healthcare services every year. Clearly, it's unacceptable. We need to do more. This year, the call to action very much focuses on patient and family engagement, as you just saw so beautifully. Why is this a key strategy for developing safer health systems? It's because it works. The evidence is there. We know it. To do this, it requires a shift from care designed for patients to care designed with patients. A dramatic shift. And today you're going to have some great examples of that shift and of those that are doing this in Canada. But it's not happening everywhere it needs to. So this call to action is appropriate and timely. And when we elevate the voice of patients, residents, clients, and families, we must then listen and learn. It needs to be an authentic engagement. At ISMP Canada, here is an overview of our mandate and actions that we do. The Learn, Share, Act cycle. That's us, and it's all about medication safety. We learn from reports that are submitted. And here's one great example where the voice of patients and residents and clients and family can come directly to ISMP Canada through medair.ca. In addition to providers and community pharmacies that are reporting to us, we listen and we act on what we hear from patients, residents, family members, and others. Then we analyze that, we learn from that, and we share it in our newsletters to consumers and in our safety bulletins to providers. This is very important learning. This comes from what people tell us directly, and it also comes from the evidence, from human factors, all combined to bring you those compelling actionable evidence-informed recommendations. And then we also partner to act. We don't just send these things out. We collaborate. We want to implement, sustain, and evaluate with you. The goal for ISMP Canada, zero preventable harm from medications. It's a lofty goal, but we can do it. I'd like to end by thanking the World Health Organization for bringing us to this day, for offering this day around the world, including to our Canadian colleagues, to be able to elevate the voice of patients for patient safety. And I want to share a special thank you to Melissa Sheldrick, our patient and family advisor for ISMP Canada. Melissa and I were invited to participate in the Global World Patient Safety Day conference last week. And Melissa opened it and started the conference with a compelling family voice for the tragic loss of Andrew, and talked about the actions and the changes that have happened in Canada since. We are very pleased to have Melissa on board, to have you here today, and we know you're going to learn. We want you to reach out to us. We're here, and we want to elevate the voice of patients even further. With that, back to you, Mike.
Thank you so much, Carolyn. I think in particular, thank you for that call to action in designing healthcare systems, and you put the emphasis on with patients and families. And I think designing healthcare with patients and family and communities is really well exemplified in our first presentation. So I'd ask Candy Lee and Turner to please tell us about your work.
Well, welcome to Indigenizing ISMP's 5 Questions to Ask. Gelakesla, Nugwa Bubasistu. Greetings. I'm a member of the Wewakai Nation by virtue of marriage, and my traditional name is Bubasistu, which means cat eyes. My everyday name is Candy Lee Chikite, and I'm a project analyst with the First Nations Health Authority on the Health Benefits and Services Pharmacy team.
And hello, everyone. My name is Turner Barrett. I'm a member of the Métis Nation of British Columbia. I'm also a registered pharmacist with a background in community pharmacy. Nowadays, I work for the First Nations Health Authority on the Health Benefits and Services team as a pharmacist, and I'm also currently an addiction pharmacy fellow with the BC Centre on Substance Use. So before we get into the content of our deck, we wanted to respectfully acknowledge the unceded ancestral and traditional territories of the Coast Salish peoples, particularly of the Musqueam, Squamish, and Tsleil-Waututh First Nations, where we're calling in from today, and also where our office is situated. It's a privilege to work and especially to live and play on these territories.
And although I'm coming to you as a visitor in Coast Salish territory today, I hail from the unceded ancestral and traditional territory of the Likwito peoples on the mid-east coast of Vancouver Island. The First Nations Health Authority, or FNHA, is the health and wellness partner to over 200 diverse First Nations communities and citizens across British Columbia. In 2013, the FNHA began a new era in BC First Nations health governance and healthcare delivery by taking responsibility for the programs and services formerly delivered by Health Canada. Since then, the FNHA has been working to address service gaps through new partnerships, closer collaboration, health systems innovation, reform and redesign of health programs and services for individuals, families, communities, and nations. We've transformed health services for First Nations people in BC by integrating FNHA clients into the provincial drug benefits insurance program and improving ease of access to benefits and services. The FNHA is also a champion of culturally safe practices throughout the broader healthcare system. Taking a leadership role, the FNHA actively works with its health partners to embed cultural safety and humility into health service delivery and improve health outcomes for First Nations people.
As Kenny Lee alluded to, the administration of pharmacy benefits was transferred from the federal non-insured health benefits program to the provincial pharmacare program here in BC. FNHA clients access a specific plan in pharmacare called Plan W for wellness. It's a comprehensive plan, it's evidence-based, and it's 100% paid with no deductible. It's funded by FNHA, which enables us to make unique modifications to the plan based on needs identified by BC First Nations communities and individuals. As you can see, FNHA has also formed very close relationships with other provincial organizations. Bringing the design of program and service delivery closer to home means that BC healthcare providers no longer need to navigate a race-based parallel pathway for providing care to FNHA clients. It results in an experience that is better for the client, one that is more likely to be culturally safe.
And we understand the importance of listening to and respecting our clients' voices. And in response to suggestions heard through community engagement, client surveys, and governance caucus meetings, FNHA has published resources on various health and wellness campaigns and topics within the health benefits program. One of the common themes voiced is that accessing medication sometimes causes challenges. However, when we looked into it, the majority of the issues heard may well have been avoided if a conversation with the prescriber or a pharmacist had taken place first. So, in order to help facilitate those conversations, we decided to adapt ISMP's 5 questions to ask about your medications resource sheet to make it conducive for our purposes and created medications questions to ask. We engaged with a panel of First Nations clients and asked what questions would be helpful to discuss with a prescriber or a pharmacist. They offered suggestions on what they felt would resonate with their family, friends, and communities to access medications and promote healthy and safer medication use. We took what we heard and created a first draft of the document, making sure to set out the information more in a chronological flow of safe medication use, rather than putting any weight or importance on a topic by numbering it. We then took the first version out to nurses and other health professionals that work in First Nations communities and solicited their feedback on the content and design. After some final tweaks, the document was ready for distribution to clients and communities.
One of the biggest modifications to the form was the addition of the questions surrounding medication coverage. We added this as we have heard from First Nation leaders that a big part of medication safety is med coverage.
This aligns with the social determinants of health. If a client is unable to get the medication due to a financial cost, then they may go without it, which often leads to further complications and severe or serious outcomes requiring higher levels of care.
We wanted to empower clients to ask about medication coverage if they wish to do so. Pharmacists in BC have several mechanisms to address med coverage issues, such as through medication adaptation, submission or assistance with special authority applications, or by collaborating with the rest of the provider's healthcare team. If the client prefers a covered option, pharmacists should be able to help. So this slide shows a large number of First Nation communities across BC, many of which are not situated in an urban area. The table on the right demonstrates how many rural and remote First Nations are multiple hour drives away from a pharmacy, sometimes on roads that are dangerous or even impassable at certain times of the year. Others are only accessible via boat or float plane. And I would imagine that rural and remote communities across Canada face similar issues. This actually brings us back to coverage. If a client lives far away from the pharmacy and there is an ongoing coverage issue at med pickup, it may result in the client returning home without the medication they need. As Kenny Lee mentioned, this can result in negative health outcomes, and it can also reinforce negative experiences that BC First Nations have faced when accessing the healthcare system.
The First Nations perspective of health and wellness outlines the importance of balance between mental, emotional, spiritual, and physical health. These aspects of wellness, which include traditional medicines, are optimal when they're all nurtured together to create a holistic level of well-being. Ancestors and elders have kept traditional medicines alive through medication mapping, back-to-land medicine gathering, and knowledge transmission through oral history in order to have present-day books and workshops. Because of this, there are plants, bark, berries, and roots that have kept communities healthy for generations, and our clients wanted traditional medicines added to the resource.
Healthcare providers may feel as if they're in uncharted waters when discussing traditional medicines, as there isn't an abundance of Western evidence. However, we do know that First Nation individuals have been using traditional methods of healing since long before colonization with beneficial effects. When clients do share this information with providers, they should not dismiss their usage. Rather, the provider should acknowledge and respect a client's choice to use these medicines. And as always, remember that clients are the decision makers of their care. Providers who work closely with First Nation clients should also consider how they can connect with the local First Nation communities and collaborate with the local health service organizations to improve service delivery. Providers who make this effort may also be offered the privilege of learning more about traditional wellness. But remember, this information may be considered sacred and this should be respected. So I did want to quickly touch on the Indigenous Cultural Safety, Humility, and Anti-Racism Practice Standard, which pharmacists in BC are now accountable to meet since it was added to the Health Professions Act in September of 2022. All of the other professional regulators also have added this to the HPA, so it applies across the board for all healthcare professionals or regulated healthcare professionals in BC. Answering the questions on this sheet we created and empowering clients to make informed decisions is a step towards providing culturally safe care. Similar standards also exist for organizations such as the BC Health Standards Organization, British Columbia Cultural Safety and Humility Standard. This standard helps governing body members and organizational leaders identify, measure, and achieve culturally safe systems and services that better respond to the health and wellness priorities of Indigenous peoples and communities, regardless of where they are located. I also wanted to quickly introduce the concept of 2 online courses that UBC will be releasing soon. We supported with the development of these in response to First Nation leaders voicing concerns surrounding safety of pharmacy interactions for their community members. These were created with oversight and guidance from a First Nations advisory and pharmacy group and incorporate designs created by a First Nations artist from Particular Indian Band. The first course focuses on the importance of cultivating relationships with First Nation clients, and the second is a series of cases. They'll be free to access and hosted on UBC's electronic learning platform. If you're interested, keep an eye out for their release. They are BC specific, but the general concepts should be applicable Canada-wide.
Adapting the ISMP document and transforming it into something that resonates with FNHA clients may seem like small changes, but they have big impact. Adding the piece on coverage, traditional medicines, providing more finite detail in questions to consider asking, inserting a QR code to access more FNHA's health benefits information, including our drug plans, and a phone number for support from FNHA health benefits assessors, all lead to client empowerment and safer medication use. From the initial collaboration with our clients through each stage to final product distribution, including this opportunity to share the work with you today, the voices of our clients have been amplified. We raise our hands in gratitude to those who provide services to Indigenous clients and urge you to reflect upon your work and determine if there's anything you can implement or change to improve their experience in safe medication access.
Thank you very much for listening.
Thank you both for that really powerful presentation. And I was particularly struck by your slide, the one titled Small Changes, Big Impact. And I think how you showed that the small changes that you made in conjunction with the community done in a sensitive and thoughtful way really had profound effects on how this information could be received and acted upon by patients and caregivers. So thank you so much for that. And now we turn our attention to another terrific project that truly integrated and elevated the voice of residents throughout the process. So I'd like to welcome Monique and Les to give their presentation. And please, I'll give you control of the slides and please take it away.
Hi, everybody. Thank you for having us. My name is Monique Patterson. I'm the Vice President of Nursing at St. Patrick's Home in Ottawa. I would like to acknowledge that we're on the unceded, unsurrendered Algonquin Anishinaabe territory. I personally am from Treaty 3, Couchiching First Nations, Ojibwe Nation, Sturgeon Clan. I'll let Les introduce himself.
I'm Les Froats. I'm President of Residents Council and very happy to be here today. Thank you.
So our home is 288 beds. We have 9 home areas, and Les lives on one of them with 31 other residents. We're quite happy to have Les included in our medication safety projects that we are endeavoring on. So I'm going to talk about our first one that we're doing. So we're talking about medication incident reporting. So our project is about medication incident reporting. So when we got together, we realized that more medication incidents would get reported if staff were informed in a timely manner about what happened to the incidents that reported. We found that it could take 2 to 3 months for staff to hear about the results of the analysis. So our goal was to reduce the time taken to provide feedback to staff after an incident report by 25%.
Yes, so the amount of time it takes to the frontline staff to get the feedback after an incident is reported. The number of medicine incidents commented. It takes up to 8 hours to figure it out and bring it forward.
Yeah.
And resident and family involvement. The team is comprised of frontline staff management, pharmacy, resident, and family council. We processed to map the entire medicine process from order to administration, the medicine early on in the project before settling on medication incidents as a specific focus. With that was completed, the whole team realized the complex of the medicine management. How it was completed, it talks about the teamwork and how it gets finished as a team.
So in our planning, we set about and we had assistance from ISMP Canada to lead us, and we process mapped our incident, like when a medication incident happens. And the gaps are the yellow areas. And one of them was just the time delays of getting back. So after the results of the process map was obtained, the team decided that an electronic medication incident reporting system would be the best way to improve the cycle.
Yes. Planning. After results of the process map was obtained, the team decided that electronic medication incident reporting system would be the best way to improve the reporting cycle. NSIR was the electrical system that the home decided to use. Training was done with 100% of the registered staff, the pharmacist, and the medical director. Learning how to communicate the reports was the last step.
So our improvements, so 100% of our medication incidents are now reported online. So this NSIR is with Kai High. We now have the ability to compare to other organizations and benchmark ourselves. So we're a standalone home in Ottawa that we're a not-for-profit Catholic organization. So we're not part of another chain or anything. So it was more difficult to benchmark ourselves. We now have frontline monthly pharmacy meetings that have been starting with reporting of the incidents more in detail. This team now reports to our quarterly meetings with our professional advisory committee to report our findings and our actions, and not just the numbers, which is what we did previously. So we're now at the point where we can report monthly to the committee and communicate the results across the home on a monthly basis. And so this more than achieves our aim or goal statement.
Okay, sustaining the results. Organized monthly meetings kept the team on track to ensure reporting of findings to the team. Integrate QC reports to reduce incident as a result of the analysis of the incident. Ensure education and provide when of onboarding new staff and passwords are attained. Backup to the online system is an email communication system to ensure residents are still kept reporting. It's very important to keep it monthly so we can keep it online and keep incidents out at a low rate reading.
Okay, sorry. So in our lessons learned, the biggest challenge is change management. So we have about 300 nursing staff. So it's important that we provided dedicated education to the staff to understand the new process. So we provided a whole day of training off the floor so they could concentrate. We were very pleased with the honest feedback the staff provided during our process mapping session. And it was really important as the supervisor of all the nurses to not talk. So my advice to the other homes is to make sure the residents and the family and the frontline staff have quality time for their quality improvement. Don't be defensive with their feedback, and thank them for the good, bad, and the ugly. It all matters. That's yours.
I thought the whole process was excellent. I believe it is important for residents to be involved. Residents Council had Monique come as a guest as the council had a concern with the new legislation with PSWs being allowed to administrate medicine. Residents feedback standing item on the agenda of the medicine, the safety team. Family and friends feedback standing that item on the agenda as well.
So in our monthly meetings, we have a Friends and Family Council on our meeting as well, and Friends and Family Council representative provides feedback to the Family Council in general, and then provide back any questions back to the team, and they meet. They're also on our monthly meeting as well. We just like to thank you.
Yes, thank you so much.
Thanks, Monique and Les, for that great project and wonderful presentation. And ISMP Canada would like to thank the Ontario Ministry of Long-Term Care for the funding provided so that we could work collaboratively with St. Patrick's Home in Ottawa and other similar homes and key partners in the sector. The views expressed in the session are the views of ISMP Canada and the home and don't necessarily reflect those of the province. The work that we all did together is also in follow-up to Justice Galisa's public inquiry into the safety and security of residents of the long-term care home system. The report recommendations regarding medication management were integrated into the entire project. And I encourage the audience to reflect upon what you heard from the team from St. Patrick's Home, particularly the words, "it all matters," and use those ideas in your own projects. Now, throughout this webinar, you've heard terms such as engage, collaborate, empower, together, but often we have difficulty finding way to connect and to discuss with others what we've learned, what we want to learn, or how we want to work together, how we want to partner to improve safety. So I'm excited to welcome Melissa Sheldrick to introduce an initiative that I think will help increase our collective impact and understand each other better and be able to work together as we drive towards a common goal of zero preventable harm. Melissa?
Thank you, Mike, and good day, everybody. My name is Melissa Sheldrick, and I'm the Patient and Family Advisor here at ISMP Canada. And it has been an absolute privilege to hear the incredible collaborations that have been presented here today. We have clearly seen the value that this partnership brings in improving medication safety for all Canadians. And that's why today, in recognition of the work that these teams have done and the theme of World Patient Safety Day, engaging patients for patient safety, we are excited to launch the Canadian Medication Safety Network. You're here today because you have an awareness of the risks and benefits associated with medications, and you're likely aware of the harm that can occur when medication errors happen. And we know that a great deal of harm is preventable, but how do we actually work together to find ways to prevent the harm? If we consider the work that Turner and Candy Lee were involved in, where they customize a resource to the local needs, and the process improvement that Monique and Les and their team undertook, we can see the potential for increased safety through collaboration. When we bring residents, patients, caregivers together with healthcare providers and other stakeholders, we create a community of like-minded individuals who want to move the medication safety needle forward. Think back to the children's acetaminophen shortages that we faced across the country last year and all of the different information and messaging that was going around. Wouldn't it have been great to hear evidence-based information about this issue from both the perspectives of clinicians and consumers? This is just one example of a timely topic where this network will be helpful. So here's a little analogy about a network. Think about a neighborhood watch program where people in a community watch out for each other. Healthcare facilities, hospitals, primary care clinics, and pharmacies are like houses within a neighborhood. Each one plays a crucial role in patient care and medication management. Medications represent valuable possessions within these houses, just as we have valuable belongings in our homes. Healthcare providers, including doctors, nurses, and pharmacists, are those vigilant neighbors who are responsible for safeguarding the valuable medications and ensuring their proper use. And so the Canadian Medication Safety Network is like the Neighborhood Watch program, bringing healthcare providers, administrators, patients, and families together to collectively monitor and learn about medication safety. They collaborate to identify and address potential risks or issues. Regular communication and collaboration among healthcare providers and consumers with the network are like neighborhood watch meetings where residents discuss safety concerns, share information, and collectively work to improve security. So just as active community involvement strengthens the Neighborhood Watch program, patients' active engagement in medication safety efforts strengthens the network. Patients play an important role in monitoring the medication landscape and providing feedback. This little analogy highlights how a medication safety network functions as a collaborative and proactive effort to protect and improve the well-being of patients and residents, much like a neighborhood watch program works to enhance the security and safety of a community. This network will engage people who reflect the diversity of Canadians from coast to coast to coast. By providing a platform to exchange ideas and dialogue, we will all learn about what is going well with medications and where there's room for improvement. We know that medication safety is a global concern, and so the ability to engage with each other will foster increased communication. There are three main goals that we've established that the network will achieve. Firstly, the sense of community that will be created will allow an exchange of ideas from the unique lens that each individual brings. There's critical data and insights to be learned from each other, and we know that informed decisions are a cornerstone of patient safety. Healthcare providers will bring their clinical expertise, and consumers will bring their expertise in real-world insights. Bringing these diverse perspectives together will lead to a more holistic approach to medication safety. Secondly, obtaining information and advice from all the experts is so valuable, and participant engagement will be core to the success of this network. That's why the Canadian Medication Safety Network strives to be accessible to all Canadians, and the active participation will be the key to learning from each other. Finally, ISMP Canada has been a trusted source for medication safety information for over 20 years. As new information emerges and the medication landscape changes, you can rely on ISMP Canada to support the Learn, Share, Act cycle that Carolyn described with evidence-based information. Consumers and healthcare providers turn to our publications for practical information and strategies to reduce preventable harm from medications. How will we do this? Well, this is the very beginning of the network, and it is going to continuously grow and be shaped with active participation from all those who register. We're planning to offer interactive webinars throughout the year, as well as developing a social media presence. Seeking advice and information from participants and then facilitating a dialogue will be key to advancing the impact of this network. This will be done through polls and surveys, social media engagement, etc. As a participant, you will be able to receive our free consumer newsletters, safety bulletins, and you'll be offered discounted access to ISMP Canada education workshops. Here are your next steps. All you have to do to register is to scan the QR code and complete the form. We'll also put a link in the chat box that you can follow to the registration form if that's easier for you. Once you submit your form, check your inbox to make sure you received your confirmation email, and then you can expect periodic emails, but we won't flood your inbox. In a few weeks, we will send you a save the date for a winter webinar. If you choose to receive ISMP Canada safety bulletins and or consumer newsletters, you can expect those approximately once every 6 weeks. You will find ISMP Canada online through these channels. Information directed towards healthcare providers is on ismpcanada.ca, and consumer information is on safemedicationuse.ca, but I would encourage you to have a look at all the information. If you have specific questions about the network, please email us at medsafety@ismpcanada.ca. Thanks so much. Back to you, Mike.
Thank you so much, Melissa. And I do encourage everybody to sign up. It's a great opportunity to get in early and help shape what the network becomes and carve out the places where you want to participate and where you can do the most benefit and where you can learn the most and share the most. So thank you for that. And I look forward to seeing how this progresses. So we've had a busy chat box today and a busy Q&A, and we thank you for submitting your comments and questions, and certainly thank the presenters. Also thank the presenters for their terrific presentations and terrific contributions. But I'd like to invite the panelists to come back now. And what we'll do is we'll answer some of the questions that have been brought up and have a bit of a discussion. So I invite Leslie, Monique, Turner, and Melissa, you're still here, and we'll ask a few questions. Thank you, everybody. And Les, I'd like to begin with you in particular. What does it mean to you as a resident in a long-term care home to be involved in, certainly the medication use, but also to participate in projects related to medication safety?
It's very important too. I think it's important that every resident has the right to get involved if they want to. I was very lucky that Monique picked me to come into the group, and she has led me through it, and it's been very good, and I don't think I could ask for any better, and I'm learning slowly, so it's been quite well.
It relates to that, Les. What have you learned about medication management in
I've learned
nursing
how
homes?
it's charted, how it's given, how long it takes to get to where it is, and all kinds of stuff. And it's been very well taken, very well taught by Monique.
And Monique, from your perspective, what impact does a resident or caregiver, patient, family member have on medication safety improvement efforts?
Well, without the residents, we have to remember that when we create policy and process, we're doing it to the residents. So we need to have their voice to know if that's what they want. Resident council will ask me to come to resident council. Like an example, self-medication policy, self-administered medication that has to go through resident council because they're the ones administering their medications if they are. They did invite me as well to when the legislation changed where PSWs could provide medications in Ontario, reassured them that we weren't going to follow that process, that we had enough registered staff to be able to provide their medications. So I think they feel more comfortable asking questions, inviting me to their meetings. As well with families, family council, we have a quite active family member, a retired nurse who has a sister in the home. And she's brings the perspective of the family and trying to remember like what information do we provide to them. If they have questions, they'll bring it through. Say there was a medication error with a certain person, they know that family member knows who else to reach out to, and she'll bring some of those concerns to me if the family have it.
Thanks so much. Turner, next question to you. Like you clearly worked a lot with the community you serve. What advice would you give to healthcare providers to get started on a collaborative effort on working with the community? Because I think just the act of getting started is sometimes quite a challenge for people.
Yeah, thanks, Michael. It's a great question. FNHA's first directive is the principle of community-driven, nation-based services that being foundational to our health governance arrangement. So it's really important for us that program, service, and policy development must be informed by grassroots level engagement. I think when we look at this on a provider level, a collaborative effort requires first building relationships with the communities and clients that providers serve. I think to do this, to start, healthcare providers need to practice with humility, acknowledging oneself as a lifelong learner when it comes to understanding others' experiences, and also demonstrating trustworthiness over time by following through on actions they commit to, and generally just supporting the client's best interests. I think from there, healthcare providers are going to be better positioned to support a collaborative effort where clients can feel confident learning from their providers and be able to make informed decisions for their care.
And as a follow-up question, do you think for practitioners it's best to start with an individual person from the community and build trust, or a small group, or is it better to just sort of approach the whole community at once?
It's going to depend on community by community. I think, as long as that engagement is respectful and it's clear that it's in the best interest of the client, and you're working as a healthcare provider to improve the health and wellness of the people that you're trying to serve, and not approaching it from a business perspective or something like that, it's generally going to be beneficial to get started on the collaborative effort. But it might initiate from a conversation you have in a clinic or in a pharmacy with an individual, and perhaps from there, by building that relationship, there's an invitation to connect with the community on a broader perspective, or maybe it's through a connection with a healthcare provider at the local health service organization and community. So it's really going to depend, but I think just going about it with a respectful approach and practicing with that humility is going to help quite a bit along the way.
Yeah, there's some great ideas for approaches there. Melissa, how can residents, patients, family members advocate to be a part of these improvement efforts?
Thanks. Well, the easy answer is to just ask. It's really important that patients and families use their voices to be heard and to communicate, and to allude to what Turner was saying about approaching with respect is also very important. We want to contribute to a culture of learning and to be safe. And so it's important that we can approach perhaps through a patient and family advisory council, or there are opportunities on medication safety committees like Monique and Les were talking about. There are board of directors who have patient advocates, patient and family advocates. So there's lots of different avenues that patients and family can look for, really specifically look for, to be able to have their voice heard. We can use social media. Sometimes that's a little bit tricky, but with my own personal advocacy work, that's been very helpful in finding an alliance of people who support your work and who elevate your work and who might put you in touch with somebody. And it really speaks to that whole idea of networking and working together.
Thanks, Melissa. Monique and Les, back to you. Les, I've had the privilege and pleasure of working with you throughout the 3 years. And you certainly contributed a lot, but how do you recruit other residents, or do you, like, how do you communicate with other residents that these opportunities are available and that they too can play a part in this?
I go and I talk to them and I tell them it's important to be part of what's going on, so so you can pick up when there's a problem. And I go and I see them and I sit with them and I talk with them, and it works. It works if you give it a lending ear. They really do listen.
Yeah, and
Monique, yeah.
Resident Council. So we actually, our residents are on all clinical teams and all our non-clinical teams and families in our home. So we go through resident council. We go through Les to recruit residents to our team. So we do try to go through resident council and family councils for that.
Turner, question for you about working with the community. What kind of feedback have you received about the changes? Are you measuring that, or are you sort of able to make changes down the road to some of the materials you've developed?
Yeah, I think we have seen perhaps a bit of an improvement in terms of less coverage issues at the pharmacy counter. I mean, this is attributable to a number of things, including the expanded scope of practice that pharmacists have here in BC now, and their ability to address those issues at the pharmacy counter. And we do certainly, listen to feedback from our communities and make changes based on the feedback we receive as part of that engagement process. So yeah, I do think we are seeing some improvements with both the system changes and some of the work we're doing in terms of our resources and other communications.
And Melissa, you've introduced the Medication Safety Network. What do you think the impact of that could be? You've heard the projects presented today, and we've had a great discussion. How can the network contribute to that to make it grow?
Thank you. I think the proof is in the pudding, right? Hearing from these teams and this person-centered approach is really key, but also that co-development of information and processes. Watching these teams go to the people that their improvement projects are going to affect and working together with them is really key. We know that person-centered care leads to safer care. And so that's what we always want to focus on. And it also improves communication so that we have, better understanding from both sides, from clinicians and from consumers, some of the challenges, some of the solutions that are out there. related to medication management. So the network is going to give us an opportunity to bring these perspectives together, and together we can transform better and we can make a really big impact on improving medication safety in Canada.
I think what great words to end on. It has been a terrific session today, and thank you to the presenters, and thank you to for the panelists for coming back and speaking to us, and certainly thanks to the audience for contributing so much. We would like to invite you again to join the Canadian Medication Safety Network. We always invite you back. We always love to hear from you. Please email us at medsafetyexchange@ismpcanada.ca if you have any comments or any questions about what you've seen. And certainly if you'd love to participate in this, you've heard Monique and Les, Candy, Lee and Turner and Melissa give us some great presentations, some great ideas to take back to our own facilities, our own organizations, and work there. So thank you to all. Please keep us in mind for our next Med Safety Exchange webinar, probably towards the end of January 2024. Please fill out the poll that you were sent or that popped out. And please continue the conversation with us. We'd love to hear from you, and have a wonderful World Patient Safety Day webinar day. Thank you so much.